Muscular dystrophy. What is muscular dystrophy? Muscular dystrophy is part of a group of over 30 inherited diseases that result in a gradual loss of strength and muscle mass. With muscular dystrophy, over time the body becomes weaker during movements. The disease is most common in children and is a condition that can eventually lead to them being in a wheelchair. How many individuals are affected by this disease? Muscular dystrophy is present in all ages, all races, and genders. However, the most common is in boys. This also is a genetic disorder, and if you have a family history with muscular dystrophy, you have a higher risk of developing the disease. Affected by muscular dystrophy. Well, individuals are affected in many different ways, but the mouth and the eyes are affected first in individuals with muscular dystrophy. This is then followed by weakness in the upper body, such as the arms, shoulders, and the chest. Muscular dystrophy can also cause motor difficulties, which can be hard for children to develop learning habits, and it can make them have a hard time learning how to walk, attempting to balance themselves. Muscular dystrophy also has muscle degression, progressive weakness, fiber death, fiber branching and splitting, chronic or permanent shortening of tendons and muscles. Lastly, another thing is muscle weaknesses can also spread to other areas of the body, such as the chest, which can cause respiratory issues among people that have muscular dystrophy. How are individuals affected by different types of muscular dystrophy? There are 5 different types of muscular dystrophy. The first muscular dystrophy is the most common type of disease, which is in children. This type of disease weakens muscles in the body, causes them to be fragile. The second muscular dystrophy, Becker, is very similar to the first one, but is less common and progressively slower. This disease is more common in boys between the ages 11 through 25. The third one, congenital muscular disorder, affects boys and girls and can be present at birth or between the age of 1 and 2. Children who have this disease can also have scoliosis, seizures, difficulty swallowing and breathing, as well as communicating, joint problems, and other vision impairment. Myotonic muscular dystrophy is most common for adults, and it affects both men and women. This disease causes difficulty with muscle relaxation and weaknesses in bowels and can cause diarrhea and constipation. Limb-girdle muscle dystrophy comes in 20 different forms. It can be diagnosed in ages as old as 40 and as young as 2. It affects the limbs of the individual's body, including shoulders, arms, legs, and hips. This can cause difficulty moving around, walking, running, climbing stairs, etc.
How are individuals affected by different types of muscular dystrophy? Facioscapulohumeral muscular dystrophy appears in men and women before the age of 20 and can show as late as age 40. They will first develop weaknesses in the mouth, eyes, upper arms, lower legs, and shoulders. Later on, their hips and abdominal area may be affected as well. Emery-Dreifuss muscular dystrophy affects young men and adolescent boys. They will lose their muscle strength in their shoulders, shins, and upper arms. Movement can also be affected because of this restriction of the spine's flexibility. Distal muscular dystrophy affects men and women between ages 40 and 60, affecting their hands, feet, lower arms, and legs. Oculopharyngeo muscular dystrophy appears in men and women within ages 40 to 50. This disease affects muscles in the face, throat, and eyes. How are individuals diagnosed with muscular dystrophy? When being diagnosed with muscular dystrophy, a physical exam is needed. From that point on, the physician can decide if a new test will need to be taken. One of those new tests may include a genetic test, blood test, heart test, neurological test, imaging test, as well as an exercise assessment and muscle biopsies. These different types of tests can help your healthcare provider determine which type of muscular dystrophy is present. Types of muscular dystrophy: Duchenne, Becker, myotonic, limb-girdle, facioscapulohumeral, congenital, distal, ocular pharyngeal, Emery-Dreifuss. Symptoms: Females affected by muscular dystrophy typically show very few or no symptoms. The symptoms that do occur vary from person to person, but may include muscle pain and cramps during exercise or physical exertion, and severe muscle weakness and dilation of the heart. In men, symptoms may include frequent falls, difficulty walking, walking on toes, difficulty getting up, laying, or sitting, muscle stiffness, muscle pain, delayed growth, learning disabilities, and partial or permanent loss of muscle. Symptoms in children may include tiptoe walking, limb pain, facial weakness, difficulty walking, climbing stairs, frequent falling, clumsy movement, trouble jumping or hopping normally. In a study conducted, 79% of those with muscular dystrophy reported that they had an enlarged tongue, 45 reported left and right crossbites, 57 reported poor oral hygiene, 77% reported posterior maximum involuntary force bite, 45% reported speech and learning difficulties, and 57% reported behavioral problems. Often, those affected by muscular dystrophy report symptoms of cardiac and respiratory effects. It was found that the age group above 13 years encounters a high risk of cardiac failures. The weak peripheral and respiratory muscles occur in parallel that leads to respiratory and heart failure. Each type of muscular dystrophy is caused by a different type of gene mutation, such as by large deletions, duplications, and other changes. This is one or more exons are doubled or deleted or changed in a nucleotide gene. Individuals can also inherit genetic mutations. DMD is an X-linked disorder, which means it is passed down from mother to son. The specific organs affected by muscular dystrophy are the heart, spine, eyes, brain, endocrine glands, gastrointestinal system, hormone-producing glands, central nervous system, and the respiratory system. Is muscular dystrophy treatable or preventable? Though the disease is not preventable, those affected with muscular dystrophy can see signs of improvement with the disease. It's been discovered that corticosteroids are known to delay the overall progression of the disease. In the first 6 to 12 months after started, they are frequently associated with some functional improvement. Recent studies highlight how the site of mutation and the involvement of different dystrophin isoforms may also affect the scores of developmental scales. Muscular dystrophy can be treated with therapies, devices, medications, and self-care. Therapies can include physical, respiratory, speech, occupational, drug, gene-based therapy, and even surgery. Muscular dystrophy, treatable or preventable? While there is no cure for muscular dystrophy, exercise programs can help reduce the symptoms of muscular dystrophy by minimizing muscle shortenings around the joints. Medical treatment for muscular dystrophy may involve the use of corticosteroids to slow muscle degeneration, anticonvulsants to control seizures, immunosuppressants to slow damage to muscle. Some misconceptions include special diets or supplements do not help muscular dystrophy. What to know about the types of muscular dystrophy? Duchenne muscular dystrophy is the most common type, begins between ages 2 and 3, affects lower limbs first, and impacts the heart and respiratory muscles later on. Becker appears between ages 5 and 15, has slower progression, affects hips and the pelvic area first, causes muscle weakness in the heart for most. Limb-girdle. There are over 30 forms, starts in either adulthood or childhood, creates muscle weakness in the atrophy in hips and shoulders. The progression is dependent on the age of the onset. Myotonic muscular dystrophy. The symptoms are early male or female pattern baldness, cataracts, heart problems, digestive problems causing stomach pain, skeletal muscle weakness, muscle atrophy, and myotonia.